Absolutely. Telemedicine is just the remote practice of medicine. And I can cite you a few examples. I've been a telehospitalist where I am working from home and I'm covering rural hospitals in Texas and have been able to provide hospitalist services in those areas where there's only an ER physician. In that environment, what you do, you have an equipment. From home, you're just doing a regular Zoom call as we're doing right now. On the other end, they have a special equipment that allow you to auscultate the patients, have an interaction with them and the families. And you can basically do this, the usual practice of hospital medicine, admit the patient to the hospital, prescribe medicine, do medication reconciliation. In the outpatient world, we're talking about similar approach. It can run from just urgent care to even primary care visits. Now, when we talk about digital health, in general, will be a more, I would say, more holistic approach. I'm going to give you another example to illustrate that. I'm working with a company, which I'm not going to use names yet, but this company offer services to recovery patients with stroke. And what we do with those patients, there's a whole team of people from occupational therapists, nutritionists, a psychologist providing support to them. So it's not the standard medical consultation. You just see those patients once and do an assessment after discharge from the hospital, but you have this whole team of people that is taking care of them and offering those resources. Now, keep in mind that when we talk about digital health, we go far and beyond. And going back to the example of Doximity, there are products within their offering that helps you, for instance, to use fax features where you can fax patients' prescriptions and it's HIPAA compliance. You can communicate with patients through HIPAA compliant text messaging. So if you think about it, the applications are quite broad. If we go to medical devices, which is part of all this movement, then we're talking about trackers, right? A lot of these patients are getting these new digital trackers to track their heart rate, blood pressure, oxygen saturation, and collected information. Of course, the most common one is the Apple Watch when it came out, and we start seeing a lot of patients coming to the hospital with new diagnosis of AFib. To tell you the truth, a lot of those patients really did not know that they did have it. With the device of this evolving technology, this has been a game changer for a lot of patients that were able to diagnose this disease before it even happened. So I think the next step, it goes even to, like, there is another company I know that is taking care of diabetes education, and that's all they do. So they have a lot of social workers and educators that most of them are bilingual because a lot of Latino and Latino patients has diabetes. So they provide just educational services. So we can see that all that is within the realm of healthcare innovation and digital health.